when it comes to mortality and cancer recurrence, they say that all antioxidants are not created equal. So I went and I looked at the results of this article. It just came out today. And he looked at carotenes plus chemotherapy, and the odds ratio was 0.75. And those of you that know epidemiology, 1.0 means that there's no change. If you have a 2.0, you've doubled the risk, and if you have a 0.5, you've actually reduced the risk by 50%. So the use of keratins and radiation treatment, the odds ratio was 2.54, which means that the use of vitamin E along with radiation therapy actually increased the risk of getting a recurrent breast cancer. But if we look at vitamin C and radiation, vitamin E and radiation, and both vitamin C and E and hormone therapy, the odds ratio was reduced to 0.6, 0.7, 0.72, and 0.7, which is about almost a third reduction in the risk of recurrent breast cancer with the use of vitamin C antioxidant use in general. So according to this brand new article on antioxidant use, that there may be a couple incidences where it may increase the risk of recurrent cancer over time. But in general, in looking at most of the results, 6 out of 7 of the combinations that they looked at actually had at least a 25 or 30% reduction in recurrent risk of breast cancer over time. So again, another powerful claim here in terms of the power of using antioxidants and proper nutrition and its use with cancer care. I'm a big fan of bovine colostrum, essential fatty acids, garlic, vegetables, legumes, astragalus root, B complex, vitamin C. All of these things have tremendous impact on the immune system. And if we look at what's the most important thing, I think, in long-term prevention of cancer and fighting the recurrence of cancer, it really is having a very, very strong immune system. So as a health educator, I like to talk to people about essential fatty acids, the use of cruciate vegetables, taking astragalus root, vitamin C in the proper amounts in terms of their fight against cancer. Developing a nutrition program, you want to work with local dietitians and nutrition experts. You want to have an all-encompassing program which looks at foods, recipes, supplements, and also charting of their food items, because some people may eat well once or twice, or they may eat well when they come to their exercise program, but they may not have a long-term program in place. We want to look at pre-screening assessments to see specific nutrition needs, and we want to meet regularly with in the group setting to discuss nutrition ideas and education. And that can actually be done in the exercise program during the cool down. We can actually talk about nutrition programs at that time. And then specific nutrition information for specific types of cancer issues like lymphedema, fatigue, muscle wasting, etc. In establishing relationships with cancer providers, who is your local oncologist? Where are your local support groups? Is there a physical therapy practice in your town or even in your center that specializes in treating cancer patients? And lastly, are there any local dietitians who work with cancer patients from both a food and supplement standpoint to at least give them the education that they need in terms of answering questions relating to the vast amounts of information, both good and bad, that there might be in terms of nutrition and cancer care. Okay, our next slide talks about marketing the program. And over the last 15 years, I have found in my discussions with people all over the U.S. that speaking to local groups is probably one of the best ways to promote the program. It's one of the easiest ways to market, and people actually get a chance to see who you are. You can speak at grand rounds at your local hospital, or you can speak at monthly cancer support groups on exercise. You can demonstrate exercises. You can talk about nutrition. You can talk with complementary professionals. You can have Q&A with doctors and nurses. And as long as you're out in the community, people are going to know that you have a program at your local medical fitness center. You can write articles in newspapers and magazines. I've done that a lot over the years. I'm sure most places will have brochures printed up. And one of the things I've also recommended is you have a site visit from your healthcare professionals. Have them see your program in action. They'll get excited when they see their local cancer patients are excited about the program as well. And then you can offer some of the information about your program to local and regional health plans, because they may be excited in terms of some sort of help with the program as well, sponsoring, etc. So in closing here, and I see I've got about 5 minutes to go, Some questions that I have heard in the cancer community. I've just been diagnosed with cancer. Can I exercise? Well, that's an interesting question. There's not a lot of research in terms of right after your diagnosis, in other words, days after. But if you've already been exercising, you can continue with a low-level program, maybe taking the first couple weeks off, and then for the first couple weeks after that, and most people start in their second round of chemotherapy. So they'll take a few weeks off of exercise, and then when they usually start in the second round, they begin a walking program, a stretching program, a breathing exercise, etc. Other people say to me, well, I have a portacath implant. Can I exercise? And I say yes. You have to stay away from water exercise, and you have to stay away from exercise machines that have heavy use. There's a lot of bacteria. You need to cover your catheter with a patch, with some gauze, and then you need to change that dressing after you exercise. You can talk about some of those issues with your doctor or your oncology nurse. The next question here is